Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
I think disabled people, just for their own well-being, because it's so hard being gaslit so constantly, like so continually, that like you start to not believe yourself. Like even myself, like sometimes I'll be like, maybe I'm faking it. And I'm like, I'm by myself, I'm in debilitating pain. Like, no, I'm not faking it. But when you hear it like almost every day, your whole life, like you start to believe it even when you don't want to.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Sarah Shaw, Senior Manager of BIPOC Community Outreach at the Global Healthy Living Foundation. I have been living with chronic migraine for almost 10 years, and I'm very open about navigating life with my chronic disease journey as well as my experience living with anxiety. This podcast will be a window into other patients' lives as they navigate their own journeys living with chronic pain, migraine, and mental health. Today, we are joined by a special guest. His name is Avi. He is a person living with migraine disease as well as a couple other chronic illness conditions, which we're going to dive into in today's episode. Hi, Avi. Welcome to the show.
Hi, thank you for having me. I'm so excited to be here.
I'm really excited to have you on. So one of the first questions I like to start each guest off of asking is if you could use one word or adjective to describe your migraine attacks, what would it be?
I mean, like probably nauseous. I have debilitating nausea from it.
Yeah. And I'm nodding, people who can't see on the podcast, I'm nodding my head along in agreement because I'm in, a 6-day migraine attack right now. And the nausea is like, I don't have the head pain today. I just have that all-encompassing nausea where you don't want to eat something, but you know you need to eat something because eating something will help make it go away, but you can't. It's a vicious cycle.
Yeah, I mean, I mostly have the symptoms that people wouldn't associate with like classic migraine. The way that people just think of migraine in general, as like headaches. If I get a headache, like it's all about the photophobia. It's all about the aura. It's about the way that like that makes me nauseous. And then it really affects the GI system. And people don't talk about that. Like I literally had the diagnosis of migraine for like 15 years before anyone was like, hey, it does things other than headaches.
Right.
Like my mom has it, like everyone in my family has it, and we still didn't know.
Would you be able to talk a little bit about this feeling, right, of having these symptoms, but not having a diagnosis, but your family has this history of it being in the family, but nobody kind of talks about that? Do you want to dig into that a little bit?
It's sort of mind-blowing because it's not like these people, my relatives and like the people who came before me who also had these conditions. It's not like they weren't trying to find help. Even most recently, my mom raising us, like she went to doctors and asked for help. Like she went to multiple different types of doctors and asked for help. And like they routinely were just like, no, there's nothing wrong. Like we went through so many evaluations as children and like almost nothing came of it. So it's just like this hopelessness, like interacting with the medical system.
Especially when you are living with an invisible illness, right? Something that people can't see. And then you add on being either a woman or a person from the LGBTQIA plus community, or add on the layers of if you're someone from a marginalized community. Like it's so hard for us to get the care that we so deserve, especially when you can't see our pain, right? It's invisible. And I'm sorry that you and your family have had to go through that. And something that we're really passionate about here at Global Health Living Foundation and Talking Head Pain podcast is making sure that patient stories that typically do not get told are given the microphone to tell their stories. And Avi and I met through a group for queer people living with endometriosis. And we got to talking and we also found out that Avi also lives with migraine attacks. And I think it's so interesting, the intersections of being a queer person and living with an invisible illness, such as chronic migraine or endometriosis. And Avi, I'd like, if you wouldn't mind, talking about your experience as a trans man and non-binary person living with migraine attacks. What has it been like for you navigating the healthcare system?
I mean, in general, it's just like this exhausting thing that I have to do. Like, it's frustrating because going into it that like the best case scenario is not super great. And every time, like, my legal's name's not changed yet. So I have to deal with that whole rigmarole every single time. And like a lot of these places don't really see the danger in and outing a trans person in their lobby. But I've been like followed back to my car and like harassed by like random people in the lobby because like you never know who's there. They're just other patients. So I've had to address that with all these different clinic systems. And that's before even getting into the care.
Right.
And when you're talking about care for like different things going on at the same time, like when I went on testosterone, like my aura got worse. And I've thought about it a lot over the years about whether I want to stay on it or not. And a big reason that I am staying on it is because it is probably helping not, the endometriosis not get like much worse. Because if I was just with my natural estrogen, like that's not good for it. That's going to flare the symptoms. So it's just this annoying like thing where I have to like pick one.
Yeah, that's exhausting, but kind of like you have to choose your battles, which versus which. And when you live with comorbidities, it's kind of like, okay, what can I do to help the one that isn't going to make the other one worse? And that's something that I've had to have discussions with my OBGYN and my headache specialist. And if you add another layer of being a non-binary person and a trans man into that, we're talking about testosterone, like that's something that you have to have serious conversations with your providers about, and you want to feel safe having those conversations with your providers. And if you can't even get into the lobby and you're dead named,
right? How
does that make you feel like you can go into the situation feeling heard, seen, validated, and safe?
Yeah. I mean, right off the bat, it like damages the relationship with whichever provider you're going to be seeing because you're already dysregulated. And I have a diagnosis of like just autonomic dysfunction. And I know part of it is like inappropriate tachycardia syndrome, but there's other stuff that we're not sure if it's something with a specific diagnosis. But in any case, the triggers for that, I mean, like with all of these conditions, right, there's triggers. So with my dysautonomia, big triggers are like stress, like very bad stress. So having to worry that I'm going to have to deal with an entire lobby full of people asking me about being trans, knowing that I'm trans, all this stuff, like it makes it hard just to like keep my heart rate down for when they're going to be taking my blood pressure and everything. Like I get comments all the time. They're like, oh, it's high. I'm like, yeah, that's because you guys have been stressing me out. Stop it.
Yeah, I have high blood pressure. I know that going to the doctor in general is a very stressful experience. Like maybe we should be playing some calming music when we go into there. Maybe not have the lights so bright, or making the atmosphere more patient-centered. And I think that leads into my next question, which it shouldn't be, but, how would you like healthcare providers and practices to engage with the LGBTQIA plus community to make their practices more welcoming, more gender-affirming? I know the word safe space it's hard to find these days, and I don't use that term lightly, but what are ways that they can make it a better environment for patients like you?
I think that the number one way that these places could genuinely enact like actual change is if they start hiring actual trans people to do the teachings, because they're not hiring trans people at the moment. Like I have been dealing with patient relations at all of these different clinic systems, and there's one large clinic system that my whole team used to be at. I would ask them, I'm getting dead named and misgendered at the gender clinic. Like, why is this happening? And they finally got me an answer on like who exactly provides their trainings. And it was the head of the gender department at this large clinic system. And she's a maybe like 70-year-old white cis woman who I had an appointment with in like 2017, 18, something like that. And she is very fatphobic. She told me at the time that like I shouldn't get top surgery until I'd lost a lot of weight because it wouldn't be aesthetically pleasing, which is just like her saying that she wouldn't be attracted to me. So why would I do it? Like, why would she say that to a patient? That's so weird.
That's not necessary in the patient space at all. And while it doesn't make you feel safe and doesn't make you feel like your top surgery shouldn't matter on that level to her.
Yeah. And it's not that it matters because everyone of every size should be able to access surgery, but my weight was not even at the limit. They're like, where they worry about if you're going to be able to fit into machines and stuff like that. It wasn't even like that. And I was bedbound for like that year. So she knew that I wasn't going to be able to get up and exercise regardless. And then after, top surgery, not only is that weight gone off your body physically, but you usually lose some more weight because you're able to walk around and do things that you enjoy and feel confident in yourself.
Right.
So it's just silly. If she wanted me to lose weight, that would have been the way to help me do it. But instead, she like actively, like she sent a message to my surgeon saying that the surgeon should gatekeep me from it until I lost weight. She told me that it's fine to refer to all trans people as transsexuals. And this is like 2018. And I was like, no, that's not fine. Like, why would you think
Wow.
that's fine? And so she's the one who's providing like these trainings to the entire system, which is probably almost 100 clinics like in the metro area here and hospitals as well.
Not good. Representation is so crucial and so important in healthcare settings. And this is the gender clinic. There should be transgender people
Yeah.
on the team helping, I don't want to say guide, but helping be that representation to have these conversations. I think, as someone who just started seeing my very first queer doctor 2 years ago, it makes all the difference for me. And I think everyone should be able to get equitable care, and there should be that representation filtered throughout healthcare. And I think you helped answer my question of absolutely, it starts at the top. And if there is not representation, helping guide these practices and helping inform medical procedures and ways to interact with patients and what to not say and what to say, that is so crucial, right?
Yeah. And there's this other clinic system, like a different one that I've been working with recently, and it's been a much more positive experience. Just like their entire response to when I have a complaint or whatever is completely different, but they are using my free labor to change all of these things that they should have hired a trans person to come and assess and, analyze and see like, where are these gaps in equity here? And I've told them this. I'm like, you should hire somebody. Like, you shouldn't just wait for me to point things out and have it all be my free labor. Even the best places, at least they're listening to me, but like they're exploiting, and I'm there for an appointment. I literally offered to them. I was like, I will provide, I don't even need to present it. You could have somebody else present it, but I will provide materials to teach these doctors, because I don't have time in my 20 minutes with this doctor that I have to talk about all my complex medical issues to also like teach them about trans stuff. Like, that needs to be a separate thing.
Absolutely. Absolutely. You shouldn't be there to give a lecture. You're there to get care for yourself, and you're there to feel better. And that should absolutely fall on the office to implement and to learn and to be better. These are conversations that are really important and that I think we need to be hearing, and the conversations that need to continue to happen. And I hope that the people that are out there listening to the podcast are willing to make changes. And I think waking up and like realizing that we need to be all in. But I think when you get into less cities and when you're more rural, we see those go far and few in between. And it shouldn't matter where you live. You should be able to get good health care no matter where you live. And you should be able to feel good and feel safe and not feel like you're giving a lecture on, hey, here's trans 101 when you're at the doctor, right?
Right. I mean, the system is so stressed. It's obviously people are leaving. There's whole parts of the United States now that are like struggling to find any OBGYNs. So obviously there's all this stuff going on. And at the same time, trans people are applying that pressure. People are standing up for themselves. Disabled people are standing up for themselves. But yeah, I think that people need to research their disability advocacy history, because that's intentionally not being taught. They don't want us to know about the 504 sit-in. They don't want us to know about how we got the ADA in the first place, because like these things are relatively recent, and like they don't want us to know about ugly laws, like about like where disabled people literally weren't allowed to just be seen in public. So, I mean, there's all these different intersections here. We're talking about like trans people with bathrooms, like all this stuff is being brought back.
Right.
And so I think like disabled people, just for their own well-being, because it's so hard being gaslit so constantly, like so continually, that like you start to not believe yourself. And I've known so many disabled people who are like, even myself, like sometimes I'll be like, maybe I'm faking it. And I'm like, I'm by myself. I'm in debilitating pain. Like, no, I'm not faking it. But when you hear it like almost every day, your whole life, like you start to believe it even when you don't want to. So I think that like researching that history and seeing that people did make a stink and they did get things as a result of it, and then that's the only way we've ever gotten results.
Yeah, I agree. And I think that's why having these conversations, having you on the podcast, being that representation, showing the medical community, hey, listen, there are trans people out there that are trying to get care, that are trying to go to your facilities, that are trying to get medical treatment, but we need more, and we need your places to be safer for us. Right now, the climate in the US, there are a lot of anti-LGBTQ, specifically anti-trans, like laws going out that are really harming the community. And one of the ways that the healthcare system can help is by not doing that, by making the one place that we should feel safe enough for trans people. And so I just appreciate you talking so openly about your experience and knowing that your story is going to be heard by other people. And hopefully we can make change happen and make another trans person out there feel like, okay, like I can do this. I'm not gaslighting myself. I know that these things exist and I can advocate for myself. And it takes a team. It takes patients speaking up. It takes the healthcare systems cooperating. It helps them being more gender affirming, welcoming, all those things. And with all those things comes obviously like mental health, right? And I talk a lot about mental health on the podcast. I live with anxiety, and I've really come to talk more openly about living with anxiety and how debilitating it can be. But I also know that there are different things that I can do to help manage my anxiety. And being a non-binary person, Avi, and a trans man, what are the little things that you do for yourself to take care of you when you're dealing with all the things that are happening, being a person living with multiple disabilities?
The little things. As an autistic person, I take a lot of refuge in music. That's one of my favorite stims, and I can listen to the same things over and over again that I've been listening to since I was a child. That's very regulating for me. I use silly putty when I'm in a stressful situation. Like I can just, and it's relatively like not going to attract attention. It's not going to bother other people there. So it's one of those ways that they like allow you to stim. You know what I mean?
Yeah.
Yeah. They're like, oh yeah, it's normal for a guy to just play with silly putty. That's normal. When it's like, no, I'm actually being autistic right here in front of you. So yeah, I mean, unmasking for me has been a key part, even like in literally like in the health of my like neuromuscular systems. And I think it's important.
Absolutely. Do you find that, like, I know for me, a big part of my self-care is community and being with people who share similar chronic illnesses as me, or people who are like the endoqueer community, or just like finding migraine people that are queer that also, you know, live with my chronic illnesses. Those have been some really, I don't know, healing like things of being in community. You talk about like being disabled and being in the disability community. Have you found that within your circles?
Yeah, I mean, I think that community is a concept that I didn't really grow up with much of as a white American with not much tangible connection to my cultural background. I think coming into community has been healing, like you said, and to see reflected. It's been healing, but it's also been painful because I have to see that not only have I gone through all of these things, but the system has done this to all these other people. And so you have to sort of sit with that massive pain. And I think a lot of autistics struggle with low empathy, but also with hyper empathy. And so the feeling of hyper empathy, of just feeling like everybody's pain, can be just so overwhelming that, of course, then you swing back to the low empathy to try and take care of yourself. And yeah, so seeing their pain is difficult. And it's like that. I don't remember who said it, but it's, let this radicalize you rather than lead you into despair. Seeing other people and like organizing with them is the only thing that matters. That's how humans came to be successful. And we've somehow like lost touch with that, with this like individualistic nuclear family experiment that's just so terrible for all of us.
I'm a big proponent of chosen family and finding my people and finding the people that uplift me and who I can uplift as well. Like I feel like there's not enough empathy and not enough compassion these days. And I feel like when I think about the disability community, the migraine community, I feel like, and the LGBTQ community, I feel like those intersections, like the little advocates that are coming out and standing up for themselves and being like, we're not going to take it. And it gives me a wonderful sense of pride and hope that we're in this together and we're there for each other. And I think that's why I brought up community, because I feel like in some ways it's been a saving grace for me.
Yeah. I was just thinking, like, brought to mind these two different creators that came up on my For You page on TikTok in the last week, that they do some gentle parenting content, but it's like specifically for their like autistic families. And just seeing like them talk about like a restraint collapse, which is like when kids come home after school and they've spent all day highly masking, and now they're in a safe place, and so they can act like wild little kids, and how like misunderstood that was in my own childhood. But to see like these parents that are like millennials, young Gen X, actively recognizing like the neurodivergence in their family and like working with it rather than against it, like it makes me sad for things that could have been. And it makes me so happy to see that things are changing.
And representation, like, I feel like is just so important for our own journeys, and seeing people speaking up and seeing the generational boundaries, like us breaking generational ties and being able to do our own healing and to see ourselves reflected in like in other people. And it gives me hope. So I appreciate you bringing that up, Avi. And I appreciate you coming on the show. It's been wonderful talking with you, learning more about you and sharing your story and your experience. And I do hope that things get better. I know that it's a long journey, but I do have hope. And I think it's a team effort for us to all keep working together. And I'm glad that we have our little things that give us hope and bring us back down. And you're able to unmask at the end of the day and be your authentic self.
Yeah, I think there is hope, definitely. And I think that it definitely lies in community.
For sure. Thank you for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you like this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing with your friends and family. It'll help more people like you find us. I'm Sarah Shaw, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.